He fought for years. I would have loved for a chance to shake his hand. My mother had a chance to shake his hand and to know him as well. And he was one of the many people who fought for causes over time in this city. And he was one of the many people who helped change the voting outcomes of Harris County last election. So I want to give a lot of honor to Bruce and thank him posthumously for his work. So a quick overview of Indivisible Houston, just so you know who we are, and just so if you have any questions or if you want to ask me anything about it, I want to make sure that you know what it is. There's a national indivisible movement. Raise your hand if you've heard of it. Awesome. Indivisible, of course, as you know, is fighting tyranny across the United States by placing local pressure on representatives to make sure that tyrannical objectives are not achieved at the federal level. In Houston, we're incorporating the state and local level also. But today's rally is about something else specifically. Today's rally is a rally against tyranny forming in the United States of America. There have been many battles before this for decades. There were people in the 1970s and 80s, not just in Houston, but across the United States, who have fought these battles and fought for rights, and they have made extensive progress. They've made lots of progress when it comes to those fights. They've made progress for civil rights, they've made progress for fundamental institutions, and they have defended the American social fabric for years. So, there were people here before us. There are also lots of people who have gotten recently activated. Who's been more active in the last few months than they've ever been politically active? It's good to see you here.
Yeah.
The American people and the American press are looking to see whether or not there's a unified coalition to stand up against tyranny. Today's rally is a very direct and clear statement. And the answer is, yes, there is. You're looking at it. And part of that unified coalition and part of what we're doing, and something that's really important, like I mentioned before, is there are people who have been fighting these battles for decades, and their voices need to be center stage when it comes to this as well. We at least need to be side by side. So every time something happens, every time a tyrannical objective comes down, every time that there's a law that tries to take civil rights away from anyone, particularly people who have had these battles for years and years and years, we need to stand shoulder to shoulder in unity and coalition and say, no, that's not the America that we're going to have. And that's really what I have to say today. That's the overview. I will tell you, if you want to get in touch with us, and we will keep coordinating with the groups that you will see today and other groups as well, you can visit it at indivisiblehouston.org. But for now, I'm going to make sure to make good on what I said, and we're going to move into the speaker list. So I'd like to welcome to the stage our first speaker. Is an independent physician. We're going to go into a discussion of ACA and tyrannical objectives, of course, that have come down the pipeline on ACA. Her name is Dona Murphey.
Hear me well?
Yes.
Okay. So I'm Donna, and I am happy to be here. Glad that Daniel invited me to speak. I'm a physician scientist. I used to work for Baylor College of Medicine. I now work for an EEG diagnostics company. I have not been politically active since 1996, when I was involved with campaigning for Bill Clinton's campaign, actually, with the Harris County Democratic Party. I think currently I would consider myself pretty politically independent, but progressive, no less. I'd say in the clinic, as a physician, we can affect the lives of patients one by one. But there's only one way, or a couple of ways I should say, to affect the lives of patients as a group. So everybody here is a patient, including myself, right? And as a group, we can only affect the lives of patients through research, policy, and advocacy. So today I'm here to talk to you about advocating for patients, and that is ourselves, right? So I realized that, hang on a second. Before I go into that, I also should make a quick mention, because I've not really had any public opportunity to do this. In a few days before November 2016, when the election occurred, I saw that there was a tremendous amount of momentum gathering for change. And I didn't really know what would become of that momentum. And at the time, I was convinced that Hillary Clinton would win the election, right? As all of us probably were convinced. But nonetheless, I knew that there were a lot of historic injustices that were occurring at that time and prior to that time, regardless of what the outcome of the election would be. Those were injustices against women, against young black men, against our American Muslim community, against refugees, against the trans community, a number of vulnerable communities in our country. And my fear, honestly, was that if Hillary won the election, that all of the momentum behind supporting each of these communities would kind of dissipate. So from that perspective, I feel that this has given us, it's galvanized us. The election outcome has galvanized us to do something really on behalf of the most vulnerable communities in America. So for that, I'm grateful, quite honestly. So a few days before the election, I started a group called the Pantsuit Republic. This was a group that spun out of a national organization at this point. Now 4 million members. I'm not clear on how politically oriented that group is, but I will tell you that Pantsuit Republic here in the state of Texas is enormously political. And we are a group of over 50,000 people across the state of Texas who are very committed to progressive outcomes. And we're not just talking about resistance. We're not just talking about reaction. We're talking about progressive, proactive change on behalf of all of the people that I just mentioned. So if any of you all, I will say it's a post-partisan feminist organization that's primarily women, but we welcome men who are allies of feminist causes, and also of the causes that I mentioned that protect other vulnerable communities. I welcome you to join our organization. The website address is pantsuitrepublic.com. So that being said, I'll put on my other hat now, which is that of a physician. The ACA, I think we have to understand that there are both many advantages of the ACA as well as some disadvantages of the ACA. I think it would be very dishonest not to recognize both. I think it would be very dishonest not to recognize that there are both advantages and disadvantages of the ACA. So for a brief overview, some of the wonderful things about this legislation are that it has really placed emphasis on preventative health care, okay? And the reason that that's so important is that really obviates the need for acute care, which is very, very expensive and very dangerous for patients, honestly. So it's wonderful that this legislation has done that. It's wonderful that they actually have also extended care to people with chronic and pre-existing conditions. That's also a huge win for that legislation. The other thing is that there are young people under the age of 26 who can continue to get health care coverage under their parents' insurance. And with a very large number of young people who are uninsured through employer-based options, this has been very critically important. The other really important thing, I think, in a lot of the judgment of the physician community is that the ACA has provided for people who have chronic mental health illnesses. This is something that has historically not been covered by private health payers, and this has been really problematic. I will say, as a neurologist, the vast majority of my patients have comorbid psychiatric illness, and these are things that deserve just as much attention and just as much money invested in it as any physical illness. I've been very happy with the fact that the ACA has covered psychiatric illnesses. The other thing is that they also cover substance abuse, which is epidemic across our country. This is an illness. It's not a behavioral choice that we make. It is an illness. And the fact that our government now believes that it should be treated as such, I think, has been also a huge victory for us. Now, that being said, again, I think it would be dishonest not to talk about the disadvantages, because a lot of us on the left here, we exist, I think, often in our little echo chambers, right? So let's talk a little bit about those disadvantages and talk about some of the possible alternatives or solutions. I think when each of us mobilizes to go out and speak to all of our lawmakers, it's important to know what the disadvantages are and important to offer solutions, because if we just are naysayers, that's not very compelling to them, okay? So some of the disadvantages of the ACA are that initially it's been a little bit expensive. Because the focus has been on preventative care, it's meant that all of the new enrollees go in and they get their preventative checkups, they get preventative diagnostic testing, and that at the front end, in the short term, is going to be a little bit more expensive, but that investment will more than pay itself off long term. And that's something we need to understand, and we need to be able to communicate to our lawmakers. Some of the other disadvantages advantages. I think that there is some concern that, for instance, medical device companies and the pharmaceutical companies will reduce their innovation because they are heavily taxed and there are fees now that are implemented through the ACA. I need to talk to you for a second about something called the medical industrial complex. Have any of you heard of this?
Yes.
Right? So historically, there has been a lot of discussion about the military industrial complex, and I'm sure in this audience there are a fair number of people who know about the prison industrial complex, right?
Yes.
So there is also a medical industrial complex, meaning there is a whole host of organizations of companies that stand to benefit from people with disease, okay? And I think that we have to have an appreciation of that. And when we ask our lawmakers to change legislation about healthcare, we have to know that these are some of the stakeholders in that process. And, you know, I can tell you that as a physician who actually has left academia for medical industry, that there is huge incentive to implement things without any evidence, really, because it looks, it's kind of sexy. It's novel technology, right? And so there is a lot of incentive to do these very expensive things in healthcare that really have not been proven to have improved patient outcomes. In countries like Norway and in a lot of other Western European countries and Australia, I think that there are lots of efforts that are being undertaken to really look at evidence-based policy. And that has made it possible to implement things like single-payer systems while also being able to I think curtail this excessive attention on the medical devices and the technology and the pharmaceutical industry that exists here in this country. So anyway, I think that a lot of these things that remain problems with the ACA are things that can be addressed with time. I think it's important for us to stand by all of the advantages that we have been able to garner, I guess, from this legislation, which has been historic. And then I think it's important for us to suggest some alternatives where there have been failures, quite honestly. Oh, I'm sorry, yes.
One of the